So can this articulation be painful? This is the question, and we saw that there are many reasons for this articulation to be painful, because the ligaments are very strong, but they have also a very nice innervation, not only from the back, but we saw also from the front. And probably one of the reasons some patients are complaining of referred pain in the larynx due to the venicity with the L5 nerve root, as shown in this nice Netherlands study. Next one. So it's a complex and mixed innervation from the lateral branches, S1, S2, S3, the dorsal rami of L3, L4, and L5. So there are many reasons for the sacroiliac joint to be painful. Next. So the sacroiliac joint received a lot of constraints, and the nutation and counter-nutation is this limited motion as shown by Bengt in his presentation. But anyway, this can be painful even if with a brace like we saw just before, by compressing the iliac wings, we can decrease a little bit the motion there to decrease the pain. It's still moving a little bit. And yes, next one. The ligaments will stabilize this articulation, but also the muscles. And as you know, the muscles can provide muscle fatigue. And it's very important to pay attention also to the muscles, because if this articulation is painful, it could be because the muscles are working too much. So the SI joint biomechanics is strongly linked with the spine shape. And what happens when the spine shape is modified by aging process or surgery? Next. So here we will have 10 slides showing a patient in a normal situation here at the beginning with a lordosis of 61 degrees, gravity line from C2, falling from C2 and crossing the femoral head, and the distance between this gravity line and the center of the sacroiliac joint. Next, and we see that when the lordosis is decreasing due to this collapse or other reasons, the distance between the gravity line and the sacroiliac joint is increasing, sorry. So next, 48 degrees now, and the distance is increasing. Next. Yeah, next one. And finally, here we are 10 centimeter. And the gravity line position is really in the front, which is not a comfortable situation for the patient. So he will never stay like this. Otherwise, he will have to use crutches to stand. So he will react against this non-economical situation. Next. The patient will back tilt his pelvis, and doing so will report the gravity line posteriorly. So it's much better. It's not economic, but it is better for the standing position. So we see that in this situation, the pelvis is back tilting. And if we go from the left side of the image now in a normal situation to the central part, next slide, we see that here the lumbar lordosis was decreasing and the pelvis start to back tilt, always to try to keep the equilibrium. And finally, at the end, the spine is in better situation, but the pelvis is totally back tilt, and the distance between the femoral head and the sacroiliac joint is multiplied by 2 or 3. So the shear forces will be increased at the level of the sacroiliac joint. And of course, the ligaments will stabilize the articulation, but the constraints are increased dramatically. Next. So the constraint on the sacroiliac joint are linked with the sacral slope. The shear forces on the sacroiliac joint are proportional to the sacral slope. When the sacral slope decreases, the shear forces increase due to the more important lever arm. As we can see here, the distance is higher between the femoral head and the sacroiliac joint, so there are shear forces there. we know that the pelvic incidence angle is almost constant, except very elderly, mainly ladies, where the ligaments are loosened, but for the others, it is constant. But it is variable from one person to another. And this is really something very important to remember. Next one. The gluteus muscle action varies according to PI. If the PI is high, the gluteus has more to do to keep the balance. In opposition, when the PI is small, the action of the gluteus muscles is smaller. Next. So we see here what happens, the difference between a large PI and a small PI. Next. And those muscles will have an action to control the pelvis nutation. But if they have to do that all the day long, you will have muscle fatigue. And this will also provide pain. And here we see that in a normal situation, low pelvic incidence, average value for pelvic incidence around 50 degrees, or high value for the pelvic incidence, the gravity line is always in good position. And for well-balanced spine, whatever the pelvic incidence is, the constraints on the sacroiliac joint is not excessive. Because the spine is well-balanced, the position of the pelvis is good. Next. But if we have to retrovert the pelvis to compensate the loss of lordosis in the lumbar spine, the distance here will be increased between the femoral head and the gravity line, and the shear forces on the sacroiliac joint will increase. And when the constraints are higher, of course, this will increase the pain. Next. So here we have the normal situation. The sacroiliac joint constraints are related to the spine. In a normal situation, here the load of the body is applied on the pelvis with the red arrow here, the body weight. This induces a pelvic retroversion naturally in a normal person. To counteract, we have those very strong posterior ligaments that we can see here that we try to keep the stability of the sacroiliac joint. So the sacroiliac ligaments are really a key to stabilize this articulation, not exactly around the articulation, a little bit at a distance, so they create a lever arm just to stabilize the articulation. Next. So we have not only the sacroiliac ligament, but we have also the muscles like the pyramidal muscle. And if this muscle is contracting all the day long, next, we see that we can have fatigue on the pyramidal muscle, and this contraction can also irritate the sciatic nerve, which is just passing over. So those are the close relationship between the sciatic and the stabilizer of the sacroiliac joint. So now in pathology, the stress and the pain depends on sagittal balance, and this has been shown since a very long time. Yes, this paper showed that the patient with sacroiliac joint pain showed retroverted pelvis and vertical sacrum, while patients without sacroiliac joint pain have normal sagittal alignment. Next. This other paper, a cause of pain after lumbar fusion. And we can see here that at least 30% have low back pain related to sacroiliac joint, and probably double in a normal situation after lumbar fusion. And we will see that the longer the fusion is, the more pain we have in the sacroiliac joint. Next. And the degeneration of the sacroiliac joint after instrumented lumbar or lumbosacral fusion. The title of the paper was degeneration. I'm not sure it's degeneration, but it is higher constraints on the sacroiliac joint. But they showed that when they compare the fusion group to a control group, that the incidence of sacroiliac joint pain or degeneration was much higher, 75%. And here, this last paper showed that L4-S1 fusion, as soon as the fusion includes more vertebrae, the sacroiliac joint stress is increasing. So in long fusion is really a very important stress. And Yann-Philippe Charles, a surgeon from Strasbourg in France, reported 2 cases of sacroiliac joint disruption after long fusion from the thorax T4 to the sacrum. So the ligaments were torn and he had to fix the sacroiliac joint after that. So this is really what it shows, is that when we have long fusion or when we need to retrovert the pelvis, we can increase dramatically the stress on the sacroiliac joint, and this is a reason for pain. And as soon as we have high pelvic incidence, we can create more stress because we have more ability to retrovert the pelvis. So in conclusion, next slide, the sacroiliac joint activities are highly linked with the lumbar spine. Next. The good spinal balance provides minimal stress on the sacroiliac joint. Decreasing the sacral slope by pelvic retroversion increase the constraints on the sacroiliac joint and increase the lever arm, which needs muscle reaction to counteract. The consequence is that the pelvic retroversion to compensate lumbar lordosis loss is stressful for the sacroiliac joint and potentially painful. The high pelvic incidence patients have more sacroiliac joint shear forces because they have more ability to retrovert and they have more possibility to have sacroiliac joint pain. Thank you for your attention.